Hello, Jennifer Shepard, Integrative Manual Physical Therapist. Today, this is a lot of exploring my own body, and I am the guinea pig. I explore many, many things. Things happen to me too. I've had my share of injuries, accidents, hormonal imbalances, GI issues. Like, I've been through it. So when you walk these things, you are much better able to speak to them and help others with them. So I injured my foot. We're going to talk about cysts. Cysts on the hand, cysts on the feet, because I've got some new hypotheses that are brewing with regard to them. Often, someone comes up with a cyst, it's like kind of hard. You can feel like the heavy, like the thicker, dense fluid underneath it. And often the remedy for that is to have it drained and or have it removed. And there are different cysts. I'm not an expert in cysts. I'm just sharing an experience that I have and what I've noticed with some other patients. So I injured my foot August, so not quite a year ago. I stepped on a kebab skewer right through the bottom of my foot, through the tissues, through the fascia. I could not walk on my foot. Dumb me, I should have put myself in a boot or I should have put myself on crutches, but no, I'm stubborn. I just worked my way through it. I ended up walking on the outside of my foot, so because I couldn't get through that bottom of my foot because I was punctured my foot. So I walked on the outside of my foot for quite a long time. August, September, October, probably a good 8 weeks, 12 weeks. And what I started having, then I started having some lateral foot pain. So as I walked on the outside of my foot, I really was jamming those joints. There's many, many joints in the foot. I was jamming the joints of the midfoot. So then when I went to go golf, I needed rotation, and those joints could not move to give me a rotation, and that would cause even more pain more on the outside of my foot. So one problem I compensated turned into a new problem. So it's gotten better. I'm treating it as much as I can. But here's what happened. I haven't played golf in a while. I went inside the simulators and played quite a bit. And sure enough, I would feel the top outside my foot. Like sometimes it'd be like a little burny, just aware. I'm like, I need to mobilize that. I need to treat those joints because they're getting compressed on a regular basis. So what shows up on the top outside my foot, I'm like, holy cow, that is a little cyst on there. So I have a picture of it. I'll have to put it on social somewhere. So my curiosity is, if I didn't injure my foot, that thing would not be there, I guarantee you. And when we get into joint mechanics, when joint mechanics are not healthy, when they're compressed, when they're jammed together, how well are the fluid dynamics? There's fluid in our cells, in our tissues, everywhere, interstitial fluid, and there are capsules around even all of the smallest joints. So this is not a capsular swelling, but rather somewhere on the edge of the joint, I am struggling to move fluid, and I irritated the joints enough, and fluids could not move out, and now it has created this little bubble, the cyst on the top of my foot. So what's interesting is, as I treat it, that cyst starts to decrease a little bit. When I haven't treated it, the mechanics of my foot, and when I play a little bit harder, that cyst starts to come back. And I've had other patients with, I'm treating for other things, for their, TMJ or something. And, hey, by the way, I've got this cyst on my foot. Like, we're supposed to just hit it with a book. So, it's not painful for them, but I am still quite certain that we have unhealthy joint mechanics at that area. And while, that cyst isn't really harmful, although as it gets bigger, if it gets bigger, it's going to be really hard to wear shoes, and could create some pressure itself. So I believe if we can mobilize, restore healthy joint mechanics throughout those areas where cysts are occurring, and often they occur on the top of the hand and the top of the foot, in my case it's the side of the foot, we can stop that cyst process forming. It also makes me think as well, the concept of cysts, going a little further and deeper into when we get cysts in the spinal cord. So we're going into arachnoid cysts, arachnoid webs. What I've seen in my patients who have those, there is a history of trauma to that area, which still makes me think, here comes impact. How did impact affect the structures, and how that impact and the structures affected have compromised healthy fluid dynamics in that area. It takes me even one step further when my patients, yes, we've got ovarian cysts, kidney cysts. I'm not so sure, or I'm curious, back to a structural component to that. How structurally healthy are those organs? How well is the blood supply in, blood supply out? How well is the lymph also in those cases, there really is a significant inflammatory process on a cellular level. So when we get into those level of cysts, I do believe you need to dive deeper into what we're putting into our bodies and really decreasing inflammation. So always curious about all things. And if you ask enough questions and you feel things and you dive deep, I do believe that we can find answers to many things that are kind of chalked up to here's just how it is, or we don't really know. I think when you ask enough questions, we